Hello, my name is James Butow, a nuclear medicine fellow at Peter MacCallum Cancer Centre. I will be presenting gallium-68 PSMA-11 PET-CT parameters of intraprostatic malignancy in the PRO-PSMA study, comparison to ICIP grade group. I do not have any conflicts of interest to declare. The PRO-PSMA multi-center randomized phase 3 study was published in The Lancet in 2020. 302 patients with prostate cancer were randomized into two groups: conventional imaging consisting of CT and bone scan, and PSMA PET-CT. The study demonstrated superior accuracy for detection of nodal or distant metastases, with PSMA PET at 92% in comparison to conventional imaging at 65%. We conducted a post-hoc analysis of the PRO-PSMA cohort, focusing on the quantitative parameters of the intraprostatic malignancy. The primary objective was to define the association between SUV max and grade group histopathology of the index lesion. Secondary objectives included determining the associations between quantitative PSMA PET parameters with baseline PSA, the risk of nodal and distant metastases, as well as the percentage of negative PSMA prostate cancers by grade group. Men with biopsy-proven prostate cancer with high-risk features were recruited from 10 Australian centres. Sites of PSMA uptake within the prostate were segmented using an absolute threshold of SUV max 4, excluding normal activity such as physiological urine. This patient is an example of widespread PSMA-avid bone metastases. Primary prostate cancer has SUV max 60 and was grade group 3 on biopsy. In this axial slice, you can see an example of a contoured lesion with the absolute threshold of SUV max 4. Quantitative parameters analyzed were SUV max, SUV mean, the molecular tumor volume, and the total lesion activity, or TLA, defined as the SUV mean times the volume. PSMA negative studies were defined as intraprostatic SUV max less than 4. Histopathology was from transperineal biopsy performed prior to imaging. The nodal and distant metastatic status was defined using a composite score, including histopathology, clinical, imaging, and biochemical follow-up at 6 months as ground truth. The baseline characteristics are summarized here. On PSMA PET, 96.6% of the 293 patients had PSMA-positive malignancy within the prostate. The mean values of quantitative parameters were SUV max 19.1, SUV mean 7.4, volume of 14.1, and TLA of 30. The 10 PSMA negative studies were evenly split between grade group 3 and 5, with the highest PSMA expression being SUV max 3.2. All quantitative parameters were significantly associated with the baseline PSA, with p-values inferior to 0.05. The most significant was the volume of PSMA-positive cancer within the prostate. Every increase in the milliliter was associated with a higher PSA of 0.87. In PSA-positive patients, there was a significant difference of SUV max by grade group of the index lesion. However, as you can see on this box and whisker plot, there is wide overlap and very similar ranges of SUV max. This is a histogram of the prostate cancer SUV max on PSMA PET. We stacked each column in a different color to better represent the differences by grade group. In green, you can see the small number of grade group 1 and 2 patients at the lower end of the spectrum. In blue, you can see grade group 3 predominantly in the categories with SUV max under 20 and declining as the SUV max increases. Interestingly, in red, you can see grade group 4 and 5 across the range values. They are much more predominant in the higher SUV max categories to the right. All quantitative parameters on PSMA PET were significantly associated with the presence of nodal or distant metastases. In this box and whisker plot, the SUV max is on the y-axis and metastatic status on the x-axis. In blue, you can see the patients without metastases to the left. The median SUV max is 12.4 with an interquartile range of 7.5 to 23. In red, you can see the 82 patients with nodal or distant metastases. The SUV max is higher at 20.5, as well as the interquartile range of 12.5 to 30. You can also notice a small number of outliers marked in both groups at the higher end of SUV max. Finally, this fantastic graph by Nathan Papa says it all. It represents the probability of nodal or distant metastases on the y-axis by SUV max on the x-axis. At the top, in red, you can see all 82 patients with metastases with different shapes based on the grade group. At the bottom, in blue, you can see all the patients without metastases, again represented by grade group. As the SUV max increases, so does the probability of nodal or distant metastases. This increase is almost linear in fashion. Around SUV max 20, you'll notice how the probability plateaus at approximately 40%. This analysis is the first prospective trial to confirm an association between SUV max and grade group, whereby the SUV max increases as the grade group increases. There is a wide range of values in each category with overlapping results, so no threshold can be used to discriminate the pathology. Our study provides the most accurate determination of PSMA negative prostate cancers at 3.4%. This is the first from a prospective trial, with previous reports on retrospective data between 5 and 10%. Interestingly, we confirm an association between SUV max of the primary prostate cancer and the risk of nodal or distant metastases, for which higher values increase the probability of metastases. One limitation is as the primary cancer increases in PSMA uptake, we expect a higher sensitivity of the PET scan as well. It is possible that some PSMA negative cancers had metastases that could not be detected. Importantly, all of these conclusions are strengthened by the fact that centers had robust ARPANET accreditation, validating the quantitative parameters. The most clinically relevant question remains: do the PSMA PET quantitative parameters of the prostate cancer have prognostic value for clinical treatment failure at 2 years? As the final follow-up phase concludes, we will have more results to share on this eagerly awaited question. I would like to thank all ProPSMA collaborators for having accomplished a remarkable trial. And a special thanks to Professors Michael Hoffman and Declan Murphy, with a special shout out to Declan for his outstanding audiovisual talents.